Most people believe cancer appears suddenly, but in reality, the human body almost never develops cancer overnight, according to long-term medical observations and research summaries from organizations such as the World Health Organization, Mayo Clinic, and Cleveland Clinic. Cancer is usually a gradual process. It can take months, sometimes even years, before a diagnosis is made. The problem is not that the body gives no signals. The problem is, the signals are often extremely subtle, and most people mistake them for normal aging. Tiredness, mild digestive discomfort, sleep changes, or small body aches. These symptoms are often ignored, but medical literature consistently shows that early-stage cancer symptoms are usually non-specific, meaning they do not clearly point to one disease. And that is why they are often missed. Hello, I am Dr. Mason, and welcome back to the channel. Today we are going to discuss something extremely important and extremely relevant for older adults. We will talk about the early warning signs of cancer that are often ignored. This video is based on medical research, clinical studies, and documented observations from institutions like the World Health Organization, Mayo Clinic, Cleveland Clinic, and American Cancer Society. Before we begin, I want to make something very clear. This video is for educational awareness only. Many of the symptoms discussed here can also occur due to harmless conditions, but awareness plays a critical role in early health decisions. Cancer is not a single disease. It is a group of conditions where normal cells in the body begin to behave abnormally under normal conditions. Cells grow, divide, and die in a controlled way, but in cancer, this process becomes uncontrolled. Cells continue to multiply without stopping over time. This may lead to the formation of a mass, known as a tumor, or in some cases, spread into nearby tissues and organs. According to the World Health Organization, early detection is one of the most important factors in improving treatment outcomes, because when cancer is found early, treatment is often more effective. Now let us go deeper. The answer is simple but important. In the early stages, cancer usually does not cause strong symptoms. Quietly, that is why it is often called a silent disease, but in reality, it is not silent. It is subtle. And subtle signals are often ignored. One of the earliest and most commonly reported symptoms is persistent fatigue. This is not normal tiredness. Everyone feels tired after work, stress, or poor sleep, but this type of fatigue is different. It is constant, unexplained, and does not improve even after rest, according to Mayo Clinic research summaries. Persistent fatigue can sometimes be associated with underlying health conditions, including chronic illness and cancer-related processes. This may happen because the body is using extra energy internally or because the immune system is continuously active. However, fatigue alone is never enough for diagnosis. It is only a warning signal. Another important early sign is unexplained weight loss. This means losing weight without changing diet, exercise, or lifestyle habits. Medical research shows that certain cancers can alter the body's metabolism. Metabolism is the system that controls how the body uses energy. When this system is affected, the body may begin to burn energy faster than normal. At the same time, appetite may slowly decrease over time. Weight loss becomes noticeable. Clinical studies show that unexplained weight loss is one of the most frequently reported early symptoms in multiple types of cancer. But again, it is not specific. It requires medical evaluation. Now let's talk about digestive changes. These are often overlooked because they feel common. Bloating, constipation, stomach discomfort, nausea, or changes in bowel habits, according to gastrointestinal oncology research. Persistent digestive changes that last for weeks should not be ignored. Many people assume these symptoms are due to diet, stress, or aging, and sometimes they are, but persistence is the key. If symptoms continue without improvement, medical evaluation is necessary. Another early warning sign is persistent cough or breathing changes, especially in older adults or individuals with smoking history, according to the American Cancer Society. Chronic cough or long-term hoarseness can sometimes be associated with lung-related conditions, including cancer. Most coughs are harmless, but what matters is duration. A cough that lasts for weeks without improvement should not be ignored. Now let's understand what is happening inside the body. Cancer begins at a microscopic level. Normal cells begin to mutate. These mutated cells lose control over their growth cycle instead of dying naturally. They continue dividing over time. They may form a tumor or invade nearby tissues in advanced stages. They may spread to other parts of the body. This process is called metastasis, according to WHO reports. Early detection significantly improves survival rates because treatment is more effective in early stages. Now let's discuss pain signals. Pain is a complex symptom. Not all pain is dangerous, but persistent. Unexplained pain requires attention. Examples include ongoing back pain, abdominal discomfort, headaches lasting weeks, or unusual body aches. Clinical oncology guidelines recommend that persistent pain without clear cause should always be evaluated, because sometimes pain is one of the body's early warning signals. Now let's understand why people ignore these symptoms. There are two major psychological reasons. First is normalization. People assume symptoms are part of aging. They say, "It is normal at my age." Second is fear. Many people avoid medical checkups because they are afraid of diagnosis. But medical studies consistently show that early detection improves outcomes significantly. Delay often reduces treatment effectiveness. Now let us talk about early screening. Screening means checking the body before symptoms become severe. Depending on age and risk factors, doctors may recommend colon screening, skin examination, blood tests, imaging scans, or lung screening for high-risk individuals according to preventive medicine guidelines. Screening helps detect conditions earlier, sometimes before symptoms even appear. Now let us discuss lifestyle factors. Lifestyle does not guarantee prevention, but it plays a supportive role in overall health. Research shows that smoking, excessive alcohol use, poor diet, lack of physical activity, and chronic stress may increase long-term health risks. On the other hand, regular movement, balanced nutrition, sleep quality, and stress management support overall well-being. At this point, it is important to understand something clearly. This video is not about fear. It is about awareness. The human body constantly communicates through signals, but those signals are often small and easy to ignore. Persistent symptoms, unusual changes, or long-term discomfort should always be taken seriously, not with fear, but with attention, because early awareness can sometimes change outcomes significantly at the end of the day. Health is not about reacting late. It is about observing early, listening carefully to your body, and taking timely action when needed. If you notice any unusual or persistent symptoms, always consult a qualified healthcare professional. Thank you for watching this documentary. If you found this video helpful, please consider subscribing, liking the video, and sharing it with someone who may benefit from this awareness. Take care of your health, stay informed, and always listen to your body.